follow-up case of chronic enteritis, and she's got hysterectomy done at the age of 35, and soon after that she suffered a vaginal hernia. All her intestine came out through that passage, and since then she's been struggling really hard with the absorption of food, and her energy levels have been really low. So she was a case of follow-up case of chronic enteritis. So yeah, she came with me. She came to me with her husband, who had some knee injury, and then I happened to ask her. They'd come back from the hospital as to why she had been to the hospital, and she told me that she's got some issue with her intestines. So she's got operated for her uterus when she was 35 years old. Soon after that, she suffered a bad hernia, and all her intestines came out through her vaginal opening, and then she was airlifted from the place. She was on a holiday, and then they did an operation on her and they sealed all that, but still she's not able to digest things better. Her intestines are always inflamed. So yeah, she's generally very low in energy levels, and even a little bit of household chores are difficult to manage. If she does a bit more just to manage herself, she has to lie down, and every 2 or 3 months she used to be hospitalized because she'll pick up infections very fast. So in the past I've helped people with my visceral manipulation techniques for things like that. So I thought of helping her, and I explained to her that I'm not sure if I will be able to help her conquer it completely, but will definitely be able to make it a bit easier for her to manage herself. So we are still in the process, and she's a bit better. Her energy levels are generally, in comparison to before, they are much better now. And we could take her off from her antacids, which she was taking twice in a day. Now she's taking none, but still she's on a medication which is to do with her intestinal motility and pain and all. Even now we struggle with her energy levels, and she's not able to absorb things that well. So, but hope floats eternal. We believe that brick by brick we'll be able to build it up again. So today, I see there's a listening from her liver, so, and gallbladder, and she seems to be. Do you feel a little acidic today? Yes. So, so you feel like bloated, or in what sense do you feel acidic?
It's not bloated, but yeah, there are cramps in the stomach.
Ah, there are cramps. And can you point out the area where you feel the cramps?
It's over here.
Yeah. So yeah, right side is the liver, and this is just my hand sensing that I was driven to the liver and gallbladder, and I'm just trying to harmonize the normal rhythm of these organs and help her get back to the normal processes. So Neha, meanwhile you can tell them, are you feeling little better than what we started with?
Yeah, much better.
Okay, so in what sense?
Energies are much better. Get more happy. Can do a lot of things which I.
So right now we're dealing with something. 2 weeks back, Neha felt she's getting a little bit infected. I don't know what happened at home, or was it something she did. And then after that she went to see off her son, and then on the way back she got tempted to have a cold coffee with her husband. See, these are all normal things, but for her it's a big challenge. So she ended up giving her husband company for cold coffee, and then she had terrible pains in her intestine, and she was badly bloated, and she just couldn't get up, very, very low energy levels. So I had to tell her that, I kept her off milk, because that's especially inflammatory for the intestines. It's hard to digest after a certain age because the enzymes going low. Now that the damage is done, we're dealing with it. She had to be on antibiotics for 5 days, and after that I'm meeting her now. So she's feeling better today. So whenever I work on her intestines, she gets this gasping kind of a feeling. So the body starts readjusting, and it's a bit too much of an information for her to process. So I have to be very, very careful and cautious. It's like dealing with her with a velvet glove all the time. So
It's okay.
are you still feeling breathless? Okay, cool. So somehow we are trying for her intestines to start moving in a normal way. Follow-up case of chronic enteritis, and she's got hysterectomy done at the age of 35, and soon after that she suffered a vaginal hernia. All her intestine came out through that passage, and since then she's been struggling really hard with the absorption of food, and her energy levels have been really low. So she was a case of follow-up case of chronic enteritis. She feels pain in her stomach, and it's difficult for her to digest food. She gets ulcers in the mouth often. Energy levels are extremely low. I mean, doing her own household chores is a big difficulty for her. So these are the complaints she has, and she feels weak all the time. And in the night especially, she has reflux issues, nocturnal reflex issues. So it's basically that dysbiosis because of all this. So I'm trying to do my visceral manipulation and other lymph techniques and brain manipulation techniques to help her come down and help her body pick up the rhythm. Thank you.
तो फ्रेंड्स, जैसा हमने लाइव सेशंस आपको दिखाए, 2 different cases we covered today, and you saw that both the clients are very much satisfied and they getting the results. तो आप यहाँ पे आ सकते हैं फ्रेंड्स, इनका नंबर मिल रहा होगा, एड्रेस मिल रहा होगा कि like you can come here, call them, and if you coming here, use our code localmarks doctors to get the whatever the best discounts, friends. You will definitely get here after using our discount code. And friends, जितना हो सके चैनल को सब्सक्राइब कीजिए, वीडियो को शेयर कीजिए, and thanks for watching this video.